Hello, my name's Neil Smith. I made a video for a while, so I thought I'd just make a very quick video, hopefully less than 5 minutes. Not even sure what to say, just really say hello and just keep up to date with what's been happening in my world with Kallmann syndrome. Um, at the moment, I've just changed treatment. I used to be on Nebido injection for a while, and that works quite well for me. But I switched for a couple of months to the gel, to testosterone gel. That works well. I just don't like using it every day. I prefer the Nebido injection, which you take every 10 or 12 weeks. But this seems to work reasonably well. But I'm going to switch back now to. Can't see it very well. But this is HCG, human chorionic gonadotropin. And this is actually Ovotrel, which is normally for female use because Pregnil, what we used to use for male HCG use, is not available in the UK anymore. So we use this Ovotrel pen, which is a syringe pen with a very fine needle for subcutaneous. So it's very easy to inject, but I inject this twice a week. So you just use a quarter of the dose. So you use it twice a week, and the pen lasts 2 weeks. But this dose is too high for male use. Well, some men can use it this high. It's over 6,000 units. So some men can use 6,000, but I tend to use that 1,600. So I do 4 doses of this over 2 weeks. It seems to work. I prefer being on HCG rather than testosterone because this produces your own natural testosterone. It's not that much more expensive than the gel, but it's sometimes not easy to get. But I actually prefer being on it if it's available. But it's an alternative sometimes. I had a hospital appointment with my consultant last week by phone because my consultant is about 200 miles away. Normally I don't mind travelling that far, but at the moment in the UK, we do most of our consultants' visits by phone. And it was a fairly standard visit. The only thing I do need is a DEXA bone density scan. That means I'm going to have to travel up there next month for about a 10-minute test. It's a very simple, straightforward X-ray, but it's just I have one every 5 years just to check for osteoporosis, and the last few over the last 10 or so years have been the same. So and I take vitamin D as well, which helps to guard against osteoporosis. I've never really been shy about talking about Kallmann syndrome and probably publicising the fact I've got the condition, or happy to talk to anybody who wants to know about the condition. So even in this COVID, at the moment where we had to get face masks, I saw online in America there was a shop selling Kallmann syndrome branded stuff. So I actually got myself a Kallmann syndrome mask, which sometimes I wear on the underground, but wear it at the moment. I can't talk very well, but I wear it on the London Underground, and nobody notices. But then on the Underground, nobody really notices you anyway. So, but I don't mind. I also got the T-shirt, and of course, a mug. I certainly don't see myself as a warrior, but I just not shy about talking about Kallmann syndrome, so I don't mind people knowing I've got it, because at my age it doesn't really matter anymore. I don't really care if people at work or cricket or anywhere I know actually know they've got a condition. And if I can publicise it online, if it helps younger people get a diagnosis, I'm more happy to do it. If I was 20, when I was first diagnosed, I would have been certainly very shy about talking about the condition. And I can remember talking to my first fellow patient I met when I was, I think, about 25, and I would have been a lot shyer back then. But now, I don't mind talking about the condition to anybody. And so I try and publicise, well, not publicise the fact, but just things that hide the fact. And if somebody asks a question about Kallmann syndrome, puberty, or anosmia, I'm quite happy to talk about it. I talk to fellow Kallmann syndrome friends online or Zoom meeting, or we have Facebook groups, and sometimes we have in-person meetings. Normally we try and have one meeting a year, either in London or in Boston, and normally around October time or November we would have a patient meeting in Boston. That probably won't happen this year because it's a little bit too difficult to travel, and people, it's just not quite normal at the moment. So hopefully next year we'll have another in-person meeting in Boston, though we'll probably have an online Zoom meeting at some stage, because I think it's quite useful for patients to get together and to talk to fellow patients. Because sometimes it's not easy to talk about the condition with other people because they don't understand, or the condition, or it's a little bit embarrassing to talk about. So sometimes it's easy to talk to people who actually know what you go through, or what Kallmann syndrome is about. Because I think part of the problem with Kallmann syndrome, well, whole fact it's a syndrome. It means it's just isn't one condition. And there's a range of different symptoms that can or may not occur in each case. And there's a whole series of what they call non-reproductive symptoms that can occur depending on the genetic cause. So you've got anosmia is the big one, lack of sense of smell. But you've also got nerve deafness, which I've got. And you've got missing kidney, mirror movements of the hands, fused fingers or toes, I can't say it, scoliosis of the back, curvature of the spine. You've also got abnormal eye movements, cleft lip, or problems with your teeth, and little things like this. There's like a whole range of different symptoms that can occur with Kallmann syndrome. They won't occur in every case, and they can maybe be very severe, or they may be very mild. Even the puberty itself in Kallmann syndrome can be no puberty at all. So like Tanner stage 1 stop, or you can like get to Tanner stage 3 and get a little bit of development and stop. So even between two different cases, or even two brothers or sisters, they'll have different levels of development. And this sometimes can cause problems when even Kallmann people talk to each other because they don't realise there's a complete range of severity of syndrome, of symptoms. So not everybody will have the same symptom or the same severity. So it's not always a case of everybody's exactly the same. And it's always sometimes quite difficult to spot somebody with Kallmann syndrome, because if they're not showing any other symptoms, it can be quite difficult to spot or diagnose Kallmann syndrome or CHH. One question of Kallmann syndrome that comes up is genetic testing, either in the diagnosis or trying to diagnose in fertility treatment the chances of passing on the condition to the offspring. And unfortunately with Kallmann syndrome, CHH, the genetics is getting very, very complex. There's now over 40 different genes and gene variants, or allies, that have been shown to cause Kallmann syndrome, and this still covers about 50% of cases. It's very difficult to diagnose Kallmann syndrome through genetics because there isn't a simple way of testing for it. Because you can't test for all 40 known gene variants, and there are other causes of it that are unknown at the moment. So you could do a genetic test that comes back as negative, but all that means is negative for the genes that we have tested so far. It doesn't mean it's not going to have Kallmann syndrome, and there's no way of predicting the chances of passing it on to an offspring unless there's a good family history of the condition and you know exactly which gene is involved. Then doctors may be able to predict with a little bit of certainty the chances of passing on. But most of us with Kallmann syndrome have no idea of the genetics behind our own cause. We can be an isolated case, or just sporadic, so nobody else known in the family. And sometimes with Kallmann syndrome, it's like what they call, it's like a 2-gene condition that there's 2 gene variants working at the same time. So you can have a gene variant going through the family, undetected, doesn't cause any problems at all, and then it's only if the second gene variant occurs at the same time we get a case of Kallmann syndrome, which does make the condition very rare. It also makes the condition very difficult to detect and diagnose because it's very difficult to know which gene variants you're looking for. So I find it very difficult when people ask questions about genetics. It's a subject I find very interesting, but there's very few clear-cut answers with genetics. And unfortunately, the answer sometimes is the doctors do not know, or they have to make guesses based on all the knowledge they have at the moment. But there's still a lot they don't know about the genetics of Kallmann syndrome and CHH. I think that's small enough for now. Just to say hello, really. I'm quite happy for people to contact. I quite enjoy talking to other people with Kallmann syndrome, and we have groups, Facebook groups, and there's Rare Connect, and we're trying to set up a rare disease American rare disease group for Kallmann syndrome as well. Trying to have like an organised patient group, which might help getting grants as well. So that's something we're looking for in the future. We have patient meetings online and in person. So I'm always trying to help people talk about Kallmann syndrome or trying to answer any questions they have. Okay, I think that's all enough for them. So goodbye.